The following program presents principles designed to promote good health. It should not take the place of personal professional care. Viewers should always consult their qualified health practitioner before considering alternative treatment.
There are things that I started to know at my practice. There are things that are sometimes so fundamental that you cannot find them in literature or somewhere because they need to go at the cause, at the problem. So, to say a little bit about me, I'm now almost 54 years, and I am doing ENT in my own practice since 14 years exactly. And there I came to know that, what usually in medicine we don't know, that is, why do we get sick? Now that's the question. Where does stress, anxiety come from? Where do the fear arise in humanity? Why certainly someone gets something during his night, hearing loss or a noise in his ear or whatever. Why does it come? What causes it? Because we know a lot of treatments, we know a lot of procedures that we can do, but we don't know the cause. And I came to understand that if you don't know the cause, where something arises, no matter what you do, you will only do a half work. Yeah, it's nothing that is complete. It's nothing that will finally get you to the place you want to go. So we will study together these things, and we will start, of course, a little bit with an introduction. Before we go into the deeper things, we must start slowly, and then we get faster and faster, you will see. But it's a nice journey. It's one that I like to go and that I am very happy to be able to share. So we as humans have a space where we live, and we are set in time, and time has just one direction. Space is the same. And then, of course, we have also around us a society. I would say these are the three big environmental things of the human being. He has a space, he has an environment he has to live in, and he has a time where he has to walk through. And, of course, he has people around himself that he has to live with. And, of course, all these three can give us big troubles, can they? And we will see if the troubles are really outside or inside. So let's see first like a short information about stress. Most people have no real definition, and I think there is no real definition for stress. Everyone uses this word like he interprets it for himself. And so to have a little bit of a structure, I say stress is a conflict with time. People try to put things into the time that is not possible. In time, you can do basic mistakes. You can live in the past. That is, you cannot get your mind off what happened in the past. That is, you would like to return. Can you return? Can anyone return in the past? Oh, there were movies when I was young. That is, that's a fantasy of humanity. We would like to be able to jump out of the time and then going back and forth. But can we? No, we cannot. And so we are limited. And so people can live in the past, which most people do. They cannot come away from what? And most diseases come from things that you cannot change in the past, that you would like to change. And basically guilt thoughts or accusations are a conflict because you would like to go back and remove them, but you cannot. And so you're stuck. And when you have a fight with the time, you certainly will win or lose. You will lose. And then, of course, you want to get forward. There are a lot of people who have a lot of worries for the future. They would like to control today that what comes tomorrow. Is that possible? But do we still try it? Yes. You find yourself how you try to do something that is impossible, but you still try it. This gentleman here in the car wants to go faster, but someone stays in his way. And what does it take from him? He thinks his time. Can anyone steal your time? Can anyone steal your time? Now, we will see if that's possible or not. Because you see, when you get angry or stressed with the person that is in front of you, who is going to be affected in his body? The one before you or the one after you? You. You are the one because you want something that is not possible. Have you ever stuck in a traffic jam and you wanted to, yeah? And what did press you? Did you feel the pressing? Especially when you go to the airport and it's late. Then you feel the pressing, especially. But it's still something impossible. You cannot jump out of time. You cannot. And we'll see the stress is mostly a conflict with time. Then fear, anxiety takes over. A lot of humans get more and more fearful and anxious. This is like pain also is growing very fast. I see this in my practice. I do counseling for anxiety and fear to more and more people because more have them. They come, of course, with me with their ear, nose, and throat issues, but since I don't look just to my field, but I go down into the whole human being, so they tell me about their fears and their anxieties and how they cannot cope with them. I just recently had a young lady, she's 18 years old, and she got her fears when she was 16. And of course, in these 2 years, she went to many doctors to help her. But fear is something very strange and something very bad. I know, have you experienced it ever? And I mean, like a panic, like something that I know it from my own experience. I know it feels the worst. I mean, better have pain than fear. Yeah, better have pain than fear. Fear, I think, is the most difficult disease that can be, because we are entering in such a state that is very, very unexplainable bad. And fear does what with you? Fear makes you wider in your space or takes your space away? It takes your space away. This young girl stopped going to school. She stopped going out without her mom. Her space of life gets smaller and smaller and smaller because she wants something to control that she cannot control. And what is that? She wants to control her life. And she thinks the space threatens her life. Is it? If she would not believe that space threatens her life, she would go at school. Because is there any security anywhere? At home or at school? Can someone push a red button and the bomb comes 8,000 miles or how far away and you know something? It's not possible. So she had an issue, and I went with her through all the counseling sessions that I will do here as well, the information, so that she gets back the control of her thoughts, which are, of course, involuntarily. But fear is something strange, very strange, because it's a fight against a pure illusion. I had a young girl, a lady, she was 27, she was married, and she got the fear about bacteria and viruses. And in her fear, when she went out, she had to cleanse her shoes by putting them in the wash machine and heating them up, or so that to kill all bacteria when she took them the next time. But you see, like in every disease, when you start to give in to fear, it gets over you, and so she came to the point where she only once wear a shoe and then had to throw them away because she could not put them on again. And I talked to her and I said, how did you survive so many years when you didn't know about bacteria or whatever dirt can be there on the street? How did you get through it? Because you're 27. You should have died for long. They would have eaten you up. But you see, it's a fear is something that is I would say a fight against nothing. I mean, a fight against a potential danger, which is not a danger. Yes? So it's not something good. I have fought fear as well, and I will say my stories as well about me. And then the conflicts basically are a problem with society. Now, all of them you have seen is a conflict. It's a conflict with time, it's a conflict with environment, and of course, then you can also fight with your people around you. And so, the most diseases do come from a conflict with someone else. So, in our life, the greatest potential to get sick is when you have conflicts in your family. When you rise up in a family where mother and father do not get along, you certainly will end up being sick or either addicted and have a non-controllable behavior. These are the two major things that happen with humanity when they come up in an environment that is not suited to themselves, and so they do something that will get them into a deep problem. So what I saw, that even the conflicts, even this fear that this young girl had was 16 started, and now she was 18, the fear didn't start from nothing, because it must have a cause, that you suddenly fear something, that you can lose your life at school while you have been already 7 years in school and nothing happened. And so there is a cause, and we will see in the end the ultimate cause of all our problems is that we do not get along with society, that is, with the people we live together. That's the most dangerous place to get sick, because we don't know how to deal with our relationships. That's where things go really deep into our life, because we were made to have relationships or not? Yes. Nice relationships? Yes, we all want nice relationships. And then why do we end up in conflicts? You see, you have these two young people, they are so in love, and then they get married, and then 2 years later they end up with me in my practice, and I have to deal with their physical diseases that come because they don't go along well in their marriage. Why do we fight? Why do we fight? Isn't that a good question? I put that question to myself. Why can I not allow other people to be like they are? Why would I like to change them? Why would I like to dominate them? Those are questions that came to me, and I was, and I'm still wondering. I know now more than when I put that question first, but it's still some things deep there in us that make us to not be peaceful people. Yeah? That to get along well, I mean, you cannot get along well with everyone, can you? Because some people are different, but if from your side you would never enter into the conflict, at least you wouldn't have any problem. The other might have a problem with you, that's fine, but as long as you don't have a problem with them, you're fine. You're out of depression and you're out of those diseases. So there are these three things, and all the other things follow in our chronic diseases. And I came to see that they all are irrational, impossible attempts. Stress is an irrational attempt to control time. It would be correct to control yourself in time, but it's incorrect to control the time that you cannot control. So that's where reason is not in its place, but irrationality is in its place. Then fear. Fear and anxiety is when you try to control that what you cannot see. Can you see the bacteria and the viruses? Can you see them? No, that's why you have the sanitizers, so to kill them. So you cannot see the things, and so you fear them. But do you think things that we don't see we should fear? And then, of course, the conflicts that we have with the people around us, that mother have with their children and children with their mother, are totally unnecessary, and they have nothing to do with our needs and our real life. So the question is, why do humans do that to themselves? Why irrationality is stronger than reason? Why do we have no solution for stress, anxiety, depression, and chronic disease? Why do we have many opinions to that? My understanding is because we don't know ourselves. The greatest unknowledge of the human being is that he does not know himself. That's what I first discovered in my practice. That was one of the first eye-opening, because all what I share with you, I didn't get out of books, because I'm more a person that studies for himself, that wants to know the things from the bottom line. And so I wanted to know what's humans' problem. And humanity's problem is that he does not know himself. And since not knowing himself, if he is supposed to guide himself, he's supposed to drive his own life, can he do it? He doesn't know where to push the buttons. Put the child into a car and say, now drive. Can he do it? No, because he doesn't know where is well, they know, they learn it very early. But as humans, we are getting adults, and we don't know where the buttons are for our life to govern it. I think that's a great, great lack. So I saw this in my patients when they came and told me their story. And I saw how in the way they explained things that somehow their view about themselves was distorted. I said, am I looking to myself the same that they look to themselves? So a doctor has a good advantage, because he can see his mirror in many of his patients and get himself to know better. But if you're not a doctor, how do you know yourself? How can you know what's going on and how to govern your life? So I found out that we have two major problems that we face in overcoming stress and diseases and to know its causes. And the first is unknowledge. And unknowledge is also false knowledge. Because I think we know a lot of things that we just took over. We never proved it to ourselves if it's right or wrong. We just took it because some doctor said it or some scientist said it, and we never thought it for ourselves. There's another thing that changed in humanity in the last decade, I think, or the last 20, 30 years. We slowly stop thinking for ourselves. We just take information without ever asking ourselves, could this be true or not? And we have that a lot of those informations. And I think what I face in my practice is it's sometimes hard when I get sick people to get them to think and reason a little bit why they got their sickness. Because you see, when you're sick, you have an advantage. Because you must do something about it. The worse the sickness is, you know you have to do something about it. And then you have a good chance to start thinking for yourself. To stop somewhere and say, okay, let's see, where is my direction going? What are the fundamentals of my own thinking? How do I do what I do? So our knowledge is the greatest problem that we have, and it's a knowledge of ourselves. We don't know how we are framed. We don't know our structure. We'll speak more about that. Our functions and the basic laws that govern our nature. Is our body governed? Are we governed by laws or no laws? Yeah, we have very fixed laws that no one can change. And if you don't know them or just ignore them, it's not so good. We just had it this winter. I know with you it's this summer, but over in Europe it was winter, and I had good friends in Romania. There's a couple, they were 40 years old, and they went to take a bath on Friday night, and they died in the bathroom because they had a heater that made the water heating with gas. And when he put that heater in, he didn't install the right air, it must go out the ventilation. And his brother told me, because the one had made the house was a constructor, he said this was the only time in his life that he didn't do the things from the beginning correctly. He put it just for a time, because he said, I will later do it, and until then we can just keep the window open. But the winter came, and it was a cold winter there in Romania, and they forgot. And carbon monoxide, does it smell? No smell, nothing. You just fall asleep. And they found him dead. The father of the lady, the father-in-law of the man. So it was a very tragic event. But you see, can we play with nature? Can we play with ventilation? Can we play with the things we don't smell? So we must know exactly the laws of nature, to govern ourselves, to be aware of them, and have them always in the back of our reasoning and our thinking. And of course, there is another thing that we face, and that's incapacity. Have you ever found yourself incapable of controlling yourself? I know for sure. Everyone. I don't know you. But I know this is a basic human problem. Humanity cannot control himself, his thoughts and actions. And if you lose your control and your thoughts about your thoughts and actions, how can you drive your car well? So we have two problems, on knowledge and incapacity. What do we need to deal first with? Of course, knowledge will help us first to become capable of doing the things, because if you don't know how to drive it and you're incapable, then of course you will drive somewhere. You see, this is what happens in medicine. I had a patient, he was 43 years old, and he came to me with a swelling of his parotid glands, salivatory glands, so the right side was more swollen than the left. And he was diagnosed with an autoimmune disease. And so, since this also falls in my field, he came to me and they said, well, your disease comes from your lack of self-control of your thoughts. Now, he was a little bit surprised. But he was referred by some relatives from him to come to me because he had seen other doctors before. But after me, he went to other doctors as well, because you have all right to go to all doctors. So he went to a nutritionist. And the nutritionist said to him, well, your problem comes because you eat flesh meat and animal protein. So he put him on a vegan diet, so that he said, if you eat vegan, the things will go away. So we started that because that's more easier than control yourself, is it? You see, it's more easy to control your not the appetite, but to a certain extent control what you eat than what you think. Would you agree with me? Yeah, I think those that are external things are easier to control than that what goes on in your mind. And then he went to the next doctor because he couldn't keep long with his diet. And he took some blood sample and found out that he had Borrelia in his blood. So he said, oh, you were beaten by a tick. Do you have ticks here in New Zealand? Yes. So, and now you have to take 3 months an antibiotic so that we can kill the germ and you get well. So how do I know the story? Because he called me at the end and said, what shall I do? Well, you see, why are we not united as doctors? Because we have one human being. Why can we not deal with humanity the same way? Why everyone has his own perception and his own, footstep where you stay on, and then just write that, and everything you put into that one thing. And do you have some good support? In anything you get some support. Yes, you can say, oh, this is this, and this is this. And so we have a lot of therapies that we can use, and there is a wide range of things. But how do you know you do it right? Would you be happy to be a doctor and you don't know what you do? This was what I found myself in my practice 14 years ago. And I still remembered my first patient that I asked to come for counseling because he had a strange thing that no doctor could find out. He suddenly started to flash his face. And if I remember well, it was only one side red, the other side not. And he went to the doctor, but until he went to the doctor, it was gone. And so they measured his blood pressure and everything. They did all the things. And he says, I just get these flashes and no one knows. I said, well, let's talk about what you think. And I remember when he came to me, and I wasn't back then used to talk to people like I'm doing it now, because I became more a counselor of my patients. And so he told me his story. And his story, the first time now when I look back, I said it fits exactly, his physical thing fitted exactly to his mindset. Because he was in a marriage He had 3 children, and he found out after, 18 years of marriage, that his wife just married him for the purpose to have children. But she never wanted to have intimacy with him. She just wanted the children, and so he said, she just used me for her own things. So he got nervous. Was he still in control? Did he know himself? No, but his body reacted very precisely on what he was thinking. So he was the first one when I started to understand that what we think must have an impact on our physical body. Because I never learned that in school. We learned a little bit of psychosomatic, but never having any structure, anything that is, complete. So I found myself in my practice that I knew to put a diagnosis, because you learn that. It's not an uneasy thing to put diagnosis. You know what you can do for a treatment, but what you cannot answer to the patient is, why do I have this? Why does this left nose is clogged and I get no air through it? Why does it have a polyp there, and why the right side is open? Why do I get my melanoma in a certain place? Why is it coming up? And so I'm sitting there as a doctor. I know to give a medication, but I don't know what to tell the patient why he has his situation. And I knew, and I experienced this, when you don't know, you're not in a good state. And to be a doctor, and you just sit in front of the patient helpless. I mean, you are helpless because you cannot help. He must help himself. But at least you can be one that can say, look, this is the point. If you do this, your problem is solved. But if you don't do this, then of course you can do many things, but you just will switch your disease to another place. Because I observed that young people came to me and they wanted to take out their tonsils. And I told them my experience with my taking out my tonsils. And I said, your tonsils are not the problem. Your tonsils just show something that is wrong. And if you take them out, you have resolved nothing. Because then that problem that causes your tonsils to be sick will go somewhere else. But the young man was very convinced. He wanted to do his surgery. And so he came 9 months later, and he was very happy because he had no throat pain anymore. So I was wondering, where did his pain go? And now he said, my knees are hurting. So what's better? You see, sometimes I wonder what we do in our medical profession. And I want to be very honest and clear that we are educated in a certain way where we do not think for ourselves. We just take the standards that are given to us, and then we don't look outside of that, unfortunately. Unfortunately, we were made to study things, but unfortunately, we are just taking in things without studying them really for ourselves. And so, would you do that in a normal profession if your house would be burning and the alarm would go on? Would you expect from the fireman to come to take off the alarm and leave the house burning? Would you find that a good way to deal with things? Yes or no? No, that's stupidity. I mean, say it in it's English, yes. So it's not my first language, but it's irrationality. No one would do it, but in the medical field, it's normality. We just fight the symptom without understanding The Mueller cause, where does it come from? Where does these tonsils burn on? Why do they are there and have their issues? No other profession would you not take first the cause and take that away and then give the treatment. I compare this sometimes also with a wall that is wet. Do you have wall wets here? Maybe you get some. And then you get the professionist to come and say, well, my wall is wet. And he will say, well, I have in my car some very good fans. They are very strong. We just put them on the wall so they dry the wall. Would you buy the fan? Why not? They're cheap. They're in offering. They're on sale. Why would you not buy them? Because after a while, who will win, the fan or the wall? Yeah, the water in the wall will always win. Except somehow something stops the water there. Then it stops together with because it doesn't get wet. But usually, if you don't stop the way the water comes from, the wall will remain wet. And then after a while, you see the wall is wet, yes, still there, and then you go and ask the person to come again, and then he will say, well, we put another fan from this side, so it covers better the wall. So would that be making sense? No. It will only make sense if you break up that wall or you look into and say, look, where are the things coming from? Let's stop the water. And then, of course, you can put for a few hours the fan. I have nothing against therapy. Yes? But you must deal all three things. You must know the cause, you must eliminate the cause, and then for me, put some dry things there, and it will help nature to recover. But therapy was never meant to eliminate the cause. You see, I am saying for my own self, since I was always a fearful person from my youth, I was afraid of medication. So did I take it when I was sick? No, I was afraid that the medication will make me more sick. So whatever came, I supported the pain. Did I die? No. Because, you see, it's similar. I don't know if you have this saying here. If you have a flu, it gets 7 days, and if you take medication, it's a week. You have that, or you have an infection? So no matter when it comes, it will go away. If nature would not have the power to repair, no disease would ever heal from what we give from therapy. That's why therapy can be only a support of nature. It can never solve the cause. So this is why I use therapy, and I'm not against therapy because it has its place. And I think medicine and what we do as an acute therapy it's all in place. I prescribe medication, but for me, it is not enough. Of course, I cannot help all my patients because not all want to think about their problems. But I'm happy, the more sick they are, the more open they are to think. Because there is something in us, and we will see that stops us really looking into our mirror. That stops us looking where we should look. Do you like to look in your mirror and see that something's wrong with you? Do you like it or not? No, I have young men and young girls. I mean, sometimes I wonder because usually when you're 15, 16, you look if your nose is straight. Yeah? But when you're 30, you shouldn't care about your nose anymore. Should it? I mean, that's normal thinking. But now I get patients that come in their 30s and says, my nose is too big. I said, but you're big, so it's nice. Everything fits together. And because, I mean, she was not big like that, but she didn't like the nostrils. She said, they are too big, so they want to do it smaller. I say, if you do your surgery to your nose, You always, whenever you look into the mirror, you will look to your nose. Ignore it. You don't see it. Look, no one. Can you see your nose? Why you see? No. So you wear it just for whom? For the other one. Now it's nice to wear a nice nose for the other ones. Yes, so they can look to it and say, oh, what a nice nose. But have you ever looked to the nice noses? I mean, I'm an ear, nose, throat. I every day look to noses, so there's nothing special for me in noses. But that's how it works in our life. So it's not easy for us to look into the mirror and see that something is wrong with us. But there is something that I hope we can see is wrong, that when we have no capacity to control ourselves, something must be wrong. And disease, in the end, is the incapacity of controlling yourself in certain circumstances that do not fit to our needs. So, let's enter into our study tonight. When we look to things, our mind is like a scale, and it must always prove the information. So on one side, the information comes in, and then it must be the truth. Would you ever accept a lie? No, because you were set just for the truth. The question is just, what is the truth? Because you were set to only accept the truth. And so you must know if the source of information is trustworthy. Do you know it? So we have a lot of psychologists, philosophers, clergy, and physicians. And they all deal with the human being. And the question is, why are they not united? Why do we have as many views as almost individuals? Now we have groups, of course, and individuals come together and group themselves, but still there is no unity. And my understanding or my answer for this is that we have no objective foundation. We have a subjective foundation. Everyone can interpret the things at his own will and capacities. You know, if you do a study, how many information can you take out of a study? You can take multiple things, and then anyone gets to its own conclusion for what he thinks the study is good for him. But it never gives a holistic view of things. So I want to do this with a little test that anyone understands me. This is a laser pointer. You see it? And it has a certain length. Yes? Is this length fixed or is it variable? It's fixed. You agree with me it's fixed? Yes. So now let's do a little exercise. You all write down in your mind, we don't have the time, what your estimation is about the length of this thing. And then we make a statistic, and then we say, this is as long as we all here came to put that statistic together. Would it be true or not? No. Because how is our own estimation? Right or wrong? How long is this? So you're a young man. 13? Anyone here? You? He said 13. 15? Someone else? 17? So 20? Yeah, so you see, the range goes from too small and too big. So what would all unite us? Yeah? So you see, that's why I got this. I had the bigger one, but someone was very not kind to me at my last meetings because I lost the other one on a meeting desk. That's why I wear a meter with me. Do you have one in your pocket? It should be very, very important because would you believe me what I say to you? Would you believe me what I say? Well, that's not good. I would never believe you if you would tell me this is 16. Because I would take my own meter and will check it for myself. Isn't that not better? Yes or no? That's what I said before. We believe things because someone has a title, an education, but let us check it for ourselves. Better check than believe. Isn't that good? And if we all check it, and all of us must measure it, then we would all be in agreement. And would we say, okay, this is 15 and 7 millimeters. Yeah? Maybe a few nanometers more or less, but that's, we have this, and it will all unite us. We would all be, would we argue about this? Would we ever argue about this? No. Yeah, there might be people who argue about that as well. So there is no limit for irrationality, I say so. But at least as long as we are a little bit of thinkers, we would say, let's take it for ourselves and measure it. So this would be, for me, that what should be the basic of our study. A measure that is outside of our own interpretation. So it's outside of your estimation. This is not an estimation. This is just an ability to read. Now, do you have to need to have that? Yes? Yes. You must read well. And if you don't read well, measure twice. But it's just a matter of reading. It's never a matter of estimation. And I hope you see the difference. Learning is not estimating things, but knowing them for sure. And for me, to know things that are estimated are relative. They don't give me any security in my medical field. Like they would give no other in his field security to do something without knowing what he does. So that's why we need a measurement that is outside of our interpretation. And do you think that's hard or easy to orient after? What would you like to put first, your estimation or the measurement? Now, I know that we all would put our estimation first. Because we are so trusting ourselves that our estimation is just correct. But always put your estimation on something that cannot fool you. And I think that we united on the metric system or on the inch system just to have what? Unity in building houses or in having measures. If we wouldn't have this, how much unity would we have? Everyone would say, okay, we make the wall like this. That's nice. It's enough. And the other wall then. And then you will see at the end that the house is, and say, okay, now let's run it down and put it again. So it's a very nice instrument and a very needed instrument. And we should have a information that is outside of ourselves, and it should have no contradiction. You see, in the things in nature, you will never find contradiction. In the laws of nature, there are no contradictions. And that's a fantastic thing to know what is right or wrong. So we must have a measure that is outside of our interpretation. And this is what I want to give you here in my presentations, that we should orient ourselves after something that is objective and cannot be changed by whatever you do. Of course, you can think what you want, but then you're putting yourself higher than the measurement, and that's, I don't think, is a safe thing. So we would all be united if we would have a measurement for humanity. Would we? What would unite us? I found 4 things that are the foundation of my study and that are the foundation that we will study together here in this week. So the first thing is we must know the law. That is, we must know the metric. This is the law in nature. We must know the fundamental law to be able to measure. Because the law will tell us everything if you know it. And I must tell you that fundamental law of nature that I study now I discovered it over the time, because I knew it, we all knew it from school, but we never give him any practical application in our life. But for me, it became the most important thing, because by it, I can measure anything. At least I can include possibilities and I exclude possibilities. If someone comes to me and says, this is 20 centimeters. Now, I can say, well, it's close, but it's not like it should be, because I know the law. Yeah, it's close, but it's outside. If you would say to me it's 16.5, it's even more close. Yeah, but I still would know it's not right. So we must have a measurement. That is, we must just be able to read and to understand. And then we can measure all things. And the fundamental law is that what we'll be studying, and it will be a fantastic study. I really like it. Then the second thing is structure. We know everything that is built must have a beginning and an end. Yes? It must have a functional beginning and a functional end. And so if we take this pen, it has a beginning and an end in its function. And so its structure is fixed or unfixed? It's fixed. So structure is fixed. So if we take humanity, if you want to be an eye physician, an ophthalmologist, how many eyes do you need to know? How many eyes do you need to know? Well, at one at least, but you can know two, because they're slightly different, because the nerve comes from, in each eye, a little bit from a different angle. But in the end, every eye has the same structure. You know, you will never have the lens before the cornea, or the other way around. You will always have it in the same order. So to be an eye doctor, you just need one eye, let's say two. To be an ENT, how many noses do you need to know? You see, when I first came into the clinic and I first looked into a nose, I didn't see anything. You know, the nose is a fantastic organ, a very big organ. We see it little here, or, you know, but inside it's a big space that goes still in the middle of your head. Yeah, and if you would cut off away this, and you would see how big that is, that place is, but if you once know the nose, you know it. Of course, every nose, anatomically, at every eye, looks different. The one is big, the other is white, the one is green, the other is red. It doesn't matter. The color and the sizes don't matter. But the structure, that is the way they're built, you will see the same. I don't look into the nose and say, the septum is in this place on a wall. No, it's always in the middle. Yeah, so this is what I mean with structure. Structure is a fixed thing. Now let us go one step further to see if you come with me. If you know one's human structure, how many human structures do you know? I didn't hear the choir so much. So if you want to know where humanity starts, how humanity is structured, if you want to know that structure in one human being, how many structures of human beings do you know? All of them. Now this is challenging. Isn't it challenging for your mind? Why is it challenging? Why is it not challenging with the eye and with the nose, but with the whole human being? Suddenly it becomes not the same. What makes the difference? Yeah, well, every eye is different. You won't find the same eye. Why do they do your eye as a identity control thing? Because your eye is singular. I mean, there is no one who has the same eye like you, or the fingerprints. So why then is it not important that what is diversity in all of us, but what's important is what is equal in all of us? And you see, if we study the diversity, will we ever get to an end? No, there is anything in nature you don't find in the same species any flower that is the same like the other one. We have here flowers, they have the same species, they are totally non-identical. And yet, in structure, they are the same. So let us understand that tonight, because when we are going to study the human structure, we study something that is equal in any one of us. Like the law that is basic to all beings. None of us is accepted from it. The same thing. Our structure is identical. So this is why I share this, because I'm so happy that I know everything about humanity. I don't know the whole structure, but I know the beginning and the big picture. And I believe even it's enough to fix the diseases and overcome the stress, the anxiety, and the fears, if you know where they start. If you know that's it, where it comes out. Because everything must have a beginning. And everything must have that beginning. And so the structure is something that I think is most important, and it will take us the most time in our study to understand the human being. But I tell you, it's a very nice thing. Do you think structure is complex or simple? Now, every structure is simple. What you do with it can be very complex. But humanity in its structure, yes, you will see it's simple, but it goes very deep. But it's not something that you cannot understand. You see, I could say this. How old are you? 13? 11? Okay, you're a little bit big. I mean, not big. I mean, you look older than you are. But that's fine in this age to tell. So, they understand it very well. If they will come to all the meetings and we ask them at the end what they understood, they will give, I know that they will understand it. It's not as a complexity that cannot be understood by anyone. It's just the capacity to deal with it. That's the difference. That's why I counsel children, but I counsel children together with their parents. And my youngest consultation I had with an 8-year-old girl. She was in fear, and she wanted to talk to me alone. And I sit there and said, how can I deal with this girl to show her what's wrong? Why does she in fear? Why does she fear to go to school? Why does with 8 years? And so that's a challenge to do that, but still, the thing that I very simply painted to her in a structure, I think she understood. I mean, I cannot follow up all my patients I counsel, but they have to do something with it. So I hope that we all understand it's not a complex study, but it's a very deep, insightful study in our human being that is very nice to do it. Then the third thing that we must know and we will study is what are our needs? What are our basic needs? And what's the power that drives us on in our life? Because without power, how much will this work? Will it work? No. It must have power, and when the power is gone, it won't do anything anymore. So we need a power. We need to know what puts us on to work, what puts us there to live right. So these are the four things: the fundamental law, the structure, the power, and the needs that we have. and the function. We must know where function begins and what is the lining up of it in a structural way. So here I have a diagram where we can just see all four together. We as humans are put here in the center of this law. We have to live inside of it. Because our life is conditioned by our needs, all our needs must be fulfilled. And if all our needs would be fulfilled, we would have normal function, that I would say that is normal health. When the needs are not fulfilled or only partially fulfilled, then we start having symptoms and diseases. And of course, we can go even a border further. There comes then death, where we have no function. So disease is on the first sight a connection that something in our life is not going correctly. Something is outside of the parameters that are set for the structure. So that was my first seeing in my practice, that something is wrong. So I said, what is missing, my patient? Because you see, on physical level, a missing can be also when you have too much. So on physical level, you can have too much oxygen or water or warmth, or too less. That's why the border is on both sides, because we measure the body. And he can have body reactions on one side or on the other side. So we take the warmth that we need, the 37 degrees Celsius, and when we have too less, we are freezing, and you have too much, you are sweating. So we have all learned, when we are thirsty, to drink, when we are tired, sometimes to sleep. At least we fall asleep later on. But what do we miss when we have fear? What do we miss when we have stress? What do we miss when suddenly our hearing doesn't go well at all? As an ENT, of course, I had my first patients coming with ear problems to me, and those ear problems, I could not know how to deal with them. Just recently, just say an example, a 20-year-old young man came, and in the middle of the night at 3 o'clock, he got awake from a great noise in his left ear and a hearing loss. And immediately in the morning he came to me, and I made the consultations and testing his hearing ability, and of course he had a hearing loss in the middle of his frequencies. Now, can this come from nothing? Can this hearing loss just be an accident? Why not? And who can make it? Maybe he got too much heat during the day. Yes or no? Could that be? Could the heat make that hearing loss in the middle of his sleep? I hope that you know that a hearing loss and that noise just happens not in the ear, just in your cortex, in your brain. It's not a damage outside. It's just a chemical dysfunction in the brain. But something must do it. It must come from something. And so now, after 14 years of understanding humanity and knowing more and more about his structure, I immediately know what's going on. Because as a doctor, you should be like any other professional. When you see something that doesn't work, you just know exactly this is it. And you can just go straight to it if you can. But my problem is that my patients don't know the problems, and so I must deal very carefully with them because I overwork them. Because you can be 43 or you can be 17, and when I tell you that your glands are swollen because you think wrong, you will say, oh, let me alone. Now I would overwork you. But nevertheless, if you would know the structure, you would know that someone pushes the button that lights up. That light can come up without the bottom. And in the night, what can happen? What has access to your brain except your thoughts? You understand? Almost most diseases, or almost all diseases that are suddenly come during the night and the early morning. Yeah? There might be thoughts that do not come that you think that night just, but they came a lot together. And I said to this young boy, I said, what happened in your life? And he said to me, and you know when you come to the ENT doctor and he asks you what happened in your life, it's a strange thing, but still I have to do it. And he being young, was hesitating to give an answer because when they are young, boys are shy sometimes. And though I insisted a little bit, I said, tell me what's going on in your heart. You must have a deep thing going on that bothers you, that damages your brain. And he looked at me and said, well, a month ago, 2 friends died. There was a girl and a boy, they were friends. They went from Germany to Thailand. They rented a motorbike and they got into an accident and died. Now I said to him, that's something that bothers you, is it? Is that something that could bother your mind? Yes. But now you need to know that how many brain sides do we have? How many brains do we have? Well, we have 2. You will say, you know why we have 2? Because they are separated on the beginning. The cortexes are not connected. And the impulses started from outside in the cortex going down. So he put his input only on the right side. No, on the left side of his brain. On the right side, the input is correct. That's why you have one-sided effects, because you have 2 inputs that are not together. And some people ask themselves, why do I have clay just in this ear and not here? Because you have 2 brains. The one side is working more and the other less. That's how easy I can say it. And so we must know a little bit the structure to understand why is it left. Now in medicine we never put these questions. But as being an ENT, I said I want to figure these things out. And so over the years, I found out what happens on the right side and what happens on the left side of your brain. And I said to him, because I knew, I said, well, that story is touching, but it doesn't fit to your brain side. You see, when you know once the body, no one can lie to you anymore. Isn't that nice? The patient, when he comes to you, he tells you exactly what he has in his heart. He tells you exactly his weight. Because the body lives, as we will see in structure, from what you think and from what relationship bothers you most. And if the relationship with his friends would bother him, he would have the loss on the right side of his brain and not on the left side. So I insisted a little bit more on him because I wanted to help the young man. And he also told me that he has, from 1 year now, he has a heart arrhythmia. I mean, he has extra systoles, and he takes, for 1 year now, beta blocker. You know the beta blocker? And he has a clogged nose that he has for many years. But those are old things. This is something acute that just happened now. And so now he tells me and says, the 2 who died, one was the sister of my girlfriend. Now tell me, about what would he thinking? The sister of his girlfriend or his girlfriend? What bothers him? So is he in need because the sister died and his boyfriend, or is he in need because he does not know how to deal with his girlfriend? what bothers him. You see, you all would say that it's his girlfriend because he now has an unhappy girlfriend. He has a person that he can deal with or cannot deal with. Is he capable to deal with the situation or not? No. And disease is the result of an incapacity to deal with things that are not fitting to our needs, that are not fitting to that what we really need. Do we need that the sister of our girlfriend should die? Do we need a girlfriend that is unhappy, that weeps, and that we enjoy together, and now she's there and you can do nothing with her anymore? So you understand, it's something that goes against us. And so you lose the capacity. And this story, I know, after 14 years of studying, I'm very happy that I could help this young man. The other issues were because his parents separated when he was 12 years old, and he has not memorized them correctly. And I asked him if he wants to solve this issue, his heart would beat again normally if he would change the way he has stored the information of his past. It's not the past that makes us sick. It's just our storage, our view of the past. So there is help for anyone. Never think the circumstances are the problem. It's just the way you see them. We will look to that as well. So I came to understand in my practice, and it took 2.5 years, that my patients have spiritual needs. Because I did not know what were they missing. Now when this young man came and he had his sudden hearing loss and his big noise, I could exactly know that he has a lack of love that made him being in a dysfunction of his body. Love, righteousness, liberty, security, and we will see the many needs tomorrow night, is something that you can grasp, or it's something that you cannot grasp. Can you measure thoughts? No. Why can you not measure thoughts? Or can you measure love? Can you measure righteousness? Why not? No, it's not a feeling. It just makes a feeling. Why can you? Because feelings you can measure, you can see them. We can make them as in a functional MRI, we can see feelings. Yes, they are visible. But what can we not see in an MRI, in a functional MRI? We cannot see thoughts. Why not? Love, what is it? Is love something that is chemistry or no chemistry? Now I hear some say chemistry, some say no chemistry. And I like the ones that say chemistry, because I challenge them to come forward and write us the exact formula of that chemical. Can you write it? Why not? Because it does not exist. If love would be a chemistry, I would be very happy. I would have invented it, believe me, because I would have had that one medicine that would remove the causes of my diseases. I would just fill up and say, oh, you miss righteousness. Let's take a few drops of righteousness. You get well. Or let's take a few drops of security and your fear is gone. Isn't that fantastic? You see, thoughts and this spiritual needs, that's why I don't call them emotional, because emotions are effects. Emotions you can measure, but spiritual needs never. Because there is no formula for that, but you need them. How do you know what righteousness is? How do you know what truth is? How do you know what security is? How do you know that bacteria are fearful. How do you know? So I came to understand that my patients had a spiritual problem, which I never learned in school. And I could not know how to deal with it. And you see, I found out with the time, when I was convinced after 2.5 years that we need spiritual things, I just said to myself, when thoughts make people sick physically, how does that work? And I came to understand that on the spiritual level, you can never have too much, because they are either or. You're righteous or unrighteous. You say the truth or not the truth. You have security or no security. How much is 99% security? No security at all. So the problem is that our body reacts to the lack of spiritual needs with 9 out of 10 diseases. And I was amazed when I first came to understand, because I am not easily convinced, because you see that I'm not taking things over from others, except I prove them first for me. And I was seeing this in my practice, that my patient, I had no other reason that they were in a need except for a thought issue. And that thought issue is just imaginary. Yes? Thought issues, you have not the thing you can say, well, take them and fill them up. So this is where I came out after 2.5 years in my practice, that I said, I have to know how thoughts impact the body. And so I started to learn that. And we will, since I got a little bit late tonight, I will finish here with my thoughts for this first lecture, because if not, you get too tired and sleep in. And we still have a few days to go. And I hope I will cover in 7 presentations the most I can cover, so that we all can get to an answer to know how our thoughts impact our physical well-being. Because if our thoughts impact our well-being, can we measure the physical? Yes. So then I can measure in the body the spiritual impact. And that's a fantastic thing. To be able to measure something that is not graspable, but to see it, how it works in the body, is a fantastic thing. That's why I so like the body, because I can orient myself after him, after like a meter, without a thing, because he works after the certain law, and I just need to know the body structure and to have a little bit know the law, to measure it all together, and then we'll find the solution. And I hope at the end of the seminar, every one of you can know what to do. At least start practicing how to overcome those things that you certainly have in your life, because I know no one that has no issues. Do you? And even me, learning the things, you still have to deal with your incapacity a long while until you get over your anxiety and fear. But of course, I had so many years fears, no one told me how to deal with it. I just was offered medication. And since I was afraid for medication, I didn't take it. So at least I didn't went into that dependency, because I know people who take the benzodiazepines for the fear, and they get so addicted to them that they never get away again. And it's worse than before, because even fear, I tell you, goes away with the time. In some cases, it disappears, but just for a time. And then it comes back like any other disease come back, you know? Like every disease comes like a blinking system, you know? It's boom, comes and goes. Even fears can go away if we wait a little bit on it. But it's better to solve the problem so that whenever you come again into that situation, you can just not react the same like you reacted until then.